So today is October 6th, exactly 1 month from the nasal reconstructive surgery. Um, Wanted to give a quick update on it. I do feel like the inflammation is going down pretty significantly. Still sound very nasally. Um, I can't, I'm a little bit blocked. I think that if I like look underneath, you can see it's crooked, and if I do this, I can make it almost absolutely straight. So I'm not sure why it's just a little teeny bit off, and I go to the doctor on Monday, and I hope I can get that straightened out because it does make a difference in the airway by just a teeny bit. So I found that I'm getting these little scabs and these little things around here, which look like to be skin developing or a scab or a scar, and for whatever reason, it just kept scabbing, and then like I don't know why they would but bleed, and so I kind of was like messing with it a little bit, and I found a stitch on the one side, and it was like a really skinny dissolvable one, I assume, but it was a knot and a big piece of a stitch that must have been either designed to dissolve or maybe missed when I had the stitches removed. But they were really, really thin sutures, and it looked like most of it has dissolved. So I'm thinking that's what it was. But then that happened like middle of the week, and then another one last night. Again, same thing. And I don't know if what's happening is I don't know if the sutures are pushing to the surface because my skin body is pushing them out. I don't really know, but or the inflammation is going down and they're exposed something. But I got the second knot and the second stitch out yesterday on the same side right here. So I still have a big tip of the nose, and I understand that's going to be the last thing to go down. I'm stuffed up quite a bit, and I'm assuming it's from the rib cartilage. But again, my airway is just slightly compromised because if I change the position, if I just put tiny pressure here, it's just enough to open the airway better on my right side. So I think some of the things I read were that um, the both sides of the nose and nostrils are not. I guess they don't heal symmetrically. In other words, one side doesn't always necessarily um, swell the same as the other, and they also don't. The swelling also doesn't reduce the same on both sides. So I read a whole bunch of stuff online that says I should expect it to be different, and for a while. So, but overall, like the appearance is looking better. 6 months and a week out from the double jaw advancement surgery. The nose on the reconstruction from a month ago is looking better. I feel more comfortable. And a lot of people are giving me feedback that see me and say, "Wow, wow, you look normal again." So it was really, really bad in terms of my really bad in terms of my appearance change. I didn't really realize it, or I knew, but you can really tell the difference again when it's been fixed, and so that's good. The rib and the abs still really are tender, and I know that's going to be a while. So I mean, I'm a month out. It's 6 weeks for a a fracture or bone to heal, and so I'm assuming it's going to be that long for that with my ribs because of the where it's located in the abs. A lot of the movement that I do does affect it. So hopeful that I'm turning the corner here. But I'm looking forward to the follow up on Monday, which would be today was a month, so it'll be a little just over a month. I hopefully get some insight, answer some questions I have. I did notice one thing, and I saw it online that I feel like my sense of smell is not quite right. But sometimes when I do smell, I get this terrible smell. Like I swear to God, it smells like a dead animal. And so I've been trying to use nasal spray, Q-tips, everything's like that. And it turns out that there could be some internal stitches or even some like crusters that get in there, and they really smell bad. It's kind of disgusting, but I'm trying to take care of it because it's nasty. Um, I can even feel my upper lip starting to get a little bit more pliable with the second incision from the removal of the screws and the two plates that were around my sinuses. So hopefully that's getting better. It's still a long way to go. So hopefully I'm progressing as I should, and that the nasal sound goes away, and again, it's really, really stiff and firm, and there's no pliability really at all. And I think I don't know if it's going to be like that forever or if it's just going to be a while. It's another question I'm going to have. I read a bunch of things about, you can massage it to get the swelling down and things like that, massage the area. And then I read some things saying, oh, don't even touch it. So I'm not doing anything till I talk to the doc on Monday. Ask some questions about that. Probably give an update on the way back and update the blog. But anyway, hope everything's going well for everybody and have a good weekend. Looking forward to coaching on the weekend and um, seeing how everything goes.